Is everything fine at your end? Audio video is fine. If you can acknowledge that, we are going to start our session now. All right. All right now, right? So I believe everything fine. So we're going to start with the. So we have got certain questions. With the help of those questions, we will be looking at the topic as a whole. So let's start with this question. A patient, 22-year-old, has dryness of the corneal surface of the eye because of the lack of tears. That's the primary concern of the patient. Which of the following nerves may be damaged? What is your answer? So basically, we are looking at the lacrimetry pathway. This is a parasympathetic one, cranial nerves. That section is very, very, very important for you guys. Okay, and you can expect questions from this area. Now, yes, dear friends, what do you think will be the answer? Mark your answer in the chat box. Your answer can be right, can be wrong, hardly matters. If you commit mistake here, don't worry. Okay, marks will not be deducted. Rather, you will learn where you went wrong. And if your answer is correct here, very well and good. Yes. Can we have an answer? Yes, dear friends. So answer to this question will be greater petrosal nerve. Greater petrosal nerve is the answer. Why? Very good. Very good, beta. Your answer is correct. D, greater petrosal nerve. Why? Because greater petrosal nerve is the one which is responsible for the, you can say, uh, for the lacrimation. So if I show you this, like we can have this ganglion that is called as pterygopalatine ganglion, where this nerve comes. The name of the nerve is greater petrosal nerve. The name of the nerve is greater petrosal nerve. And after, you see, there is relay, it will be taken by zygomatic branch, which further divides into two branches, that is zygomaticofacial and zygomaticotemporal. Fine. And we have one nerve which is lacrimal nerve, which is going to supply one gland. As the name suggests, it is going to supply the lacrimal gland. But what is lacrimal nerve? Lacrimal nerve itself is a sensory branch. It is only carrying the sensation from the gland and from the adjoining areas. Okay, but it does not have the lacrimetry fibers. Lacrimetry fibers will be added by this branch, which is coming from zygomaticotemporal. It goes and joins with the lacrimal nerve. So the lacrimetry fibers are going this way, this way, this way, and finally reaching to the lacrimal gland like this. Do you understand, beta? All of you, Bhavna, Vivek, Med Dental, Feel the Dentistry, all of you are correct. You have given the correct answer. Very good. Now the question is, when we said this A choice was there, lacrimal nerve, why this was not correct? Because if you make the, you see, any injury here in the proximal part, then there is no loss of lacrimation. Why? Because it does not even have the lacrimetry fiber. ये सबको समझ आ गया है. इसमें lacrimetry fiber ही नहीं है तो कटेगा कहाँ से? But if you are going to dissect over here, like in the distal half, yes, in the distal half there will be loss of sensation as well as there will be additional loss of lacrimation also. Please confirm in the chat box, is it clear why A choice was not the answer? Moreover, we have the zygomatic branch. If zygomatic branch is there, why B was not the answer? Because B is saying zygomatic of the facial. Zygomatic branch of the facial nerve is the one which is going to supply the muscles of the facial expression, that means motor. But this zygomatic is nothing but the branch of maxillary. That's why B is also not correct. So, very good. What will be the effect? Very good. Yes, so in the nutshell, I can describe that also. No, don't worry about that. So, if we look at this way, the next question that Dr. Saab is saying कि अगर facial nerve को काट दे तो क्या होगा? Suppose is a fish, we can say कि ऐसे, like let us assume this is the middle ear, this is middle ear, and we have the nerve coming. This is the nerve which is making a bend going behind vertical segment coming out of this foramen, stylomastoid foramen. Stylomastoid foramen. I hope that makes sense. It gives one branch over here, greater petrosal nerve, which we have learned so far. It is the nerve for lacrimation. Second branch is given, which is nerve to stapedius. Nerve to stapedius, which is for the stapedial reflex. Then we have this branch, which is chorda tympani. Now, chorda tympani has got two roles. One, it is for the salivation from submandibular gland and sublingual gland. Moreover, it also carries the taste from the anterior two-third of tongue. I hope that makes sense. And finally, this comes out and it passes through the parotid gland, okay, like this, the parotid gland over here, and then divides into 5 branches. These branches are going to supply the facial expression muscles. So where can be the injury, dear friends? Injury can be here at A level. If injury is here, it will lead to facial palsy. It will lead to facial palsy, correct? What about B level? Above the chorda tympani. So A plus loss of taste from anterior two-third of tongue. If injury is at C level, then whatever is happening at B will definitely happen. Along with that, there will be hyperacusis. And if the injury is at D level, right, then C plus loss of lacrimation. And you will get this PDF, okay? PDF of all these notes what I'm writing, you will be getting. Okay, so focus on learning right now. I hope all the concepts are clear. Now we know greater petrosal nerve is for the lacrimation. We know the chorda tympani nerve is for salivation as well as for the taste. But if I ask you lesser petrosal nerve, if I ask you lesser petrosal nerve, what is the role? Can you tell, beta? Greater petrosal nerve, done. Chorda tympani, two roles, done. Facial nerve at different level of relation, done. What about the lesser petrosal nerve? It is the one which is responsible for salivation, sorry, which is responsible for salivation from the parotid gland, from the parotid gland, like this. So I hope everything is fine. And now let us move on to the next question. Which of the following reflexes test the integrity of nucleus ambiguus? Now, what is nucleus ambiguus? Nucleus ambiguus is a compound nucleus of three nerves, that is 9th, 10th, and 11th nerve. Jaw reflex is mediated by the trigeminal nerve. It's a mandibular nerve majorly, that is the one responsible. Stapedial reflex, it involves the 8th nerve, that is where the auditory input will be coming, and also it involves the 7th nerve, which is giving the nerve to stapedius for the stapedial reflex to take place. For the gag reflex, afferent will be 9th, efferent will be 10th. For the corneal reflex, afferent will be V1, efferent will be 7th. So gag reflex is the one which is mediating like 9th, 10th, and 11th. C. All of you are correct, beta. Komal, Nikesh, Bhavna, and feel the dentistry, right? I can really feel. You have chosen a fantastic name. Huh? Very good. Next question. During a thyroid operation, a nerve coursing along with the superior thyroid artery is injured. What can be the possible consequence? Yes, what do you think will be the answer over here? So here, let me add one mnemonic. We have one mnemonic that is rise. What is rise is recurrent laryngeal nerve accompanies inferior thyroid artery and external laryngeal nerve accompanies superior thyroid artery. So which nerve is gone? The one who is accompanying the superior thyroid artery, and we can say it is the external laryngeal nerve. Do you appreciate? If external laryngeal nerve is gone here, if at all, so like we have to go step by step. First step, which nerve is gone? The one who is accompanying superior thyroid artery, and that will be accompany like who is accompanying it? External laryngeal nerve, which is accompanying the superior thyroid artery. Okay, and external laryngeal nerve is not sense, like it's not sensory, it's motor. So answer will be D, paralysis of the cricothyroid muscle. Do you appreciate? Above the vocal cord sensation is because of internal laryngeal nerve, and loss of sensation below the vocal cord is because of recurrent laryngeal nerve, and this will be also supplied by recurrent laryngeal nerve just like any other muscle of the larynx. Is that all okay? So far, so good. Can we proceed further? Yes. Now, there's something which has been marked, and can you tell in this diagram what is the answer? What is the marked area, beta? What is the marked area? Let's start identifying over here. See, whenever you get this type of section, ना, ये जो ऊपर है बीचों बीच midline, that will be corpus callosum. Please remember this is corpus callosum. The mark structure is nothing but fornix, and in between we have a vertical segment. So we above we have corpus callosum, below we have round fornix. But corpus callosum and the fornix are connected by this vertical segment which is called as septum pellucidum, which is called as septum pellucidum, like that. And what is this? Is the these are the two thalami. T for thalamus, T for third. Between the two thalami, we have third ventricle. If this is third ventricle, these are two lateral ventricles. That means septum pellucidum is the medial septum between the two lateral ventricles. What is this? Nucleus. This is caudate nucleus. This is caudate nucleus, and this nucleus is lentiform nucleus. It is the lentiform nucleus because it looks like lens. Caudate and lentiform are part of what? They are part of basal nuclei. Now, dear friends, this question is for everyone. Can you tell me the name of these fibers which are present between caudate and lentiform and the thalamus? Whatever space is there in between these big nuclei, caudate, lentiform, and the thalamus, these fibers are coming down. What is the name of these fibers? These fibers are called as internal capsule. These fibers are called as internal capsule. And what is this? Is insula. This is insula. Very good, beta. Now the question is, if this is fornix, what will be the answer? Now, who is sending the efferent via fornix. And answer to this question is correct. Very good, beta Nikesh. That's the correct answer. Hippocampus is the answer over here. Why? Because if I show you this, there is something called as Pepe circuit. What is that? So for that we will remember this mnemonic mace. Hippo mace is our mnemonic. What is that? So we have hippocampus. Hippocampus is the one which is sending some fibers to mammillary body. Mammillary body. This mammillary body is connected to anterior nucleus of thalamus, which is connected to cingulate gyrus. Cingulate gyrus, which is further connected to entorhinal cortex. Entorhinal cortex. And this is connected to hippocampus. So that becomes a circuit. Now, there are two important points. First, what is the name of the circuit? Pepe circuit. That is the name of the circuit, Pepe circuit. Second, what's the name of this efferent, which is coming from hippocampus and going to mammillary body? That is nothing but the fornix. So in the diagram, we have seen the fornix. Do you remember the fornix, which was marked over there? So this fornix is nothing but it is the efferent coming from the hippocampus, and these are the same fibers which are reaching the mammillary body. Now the point here is, what is the role of Pepe circuit? Now this question is open for all of you. Can you please tell beta if you have any idea about this Pepe circuit? What is the role? What is the physiological role? इसका function क्या है? इससे होता क्या है? Hippocampus is site of what? ये सारा कुछ circuit create करके hippocampus ने क्या role play करा? What is the benefit? Clinical significance. So this is involved in the consolidation of the memory. It is involved in the recent memory basically. Okay. So sometimes it might happen so that a patient meets with an accident, road traffic accident, but at the time of accident, that accident particularly, that event of the accident, it happens so suddenly that hippocampus went into the shock. That means the patient's hippocampus went into shock at the time of accident. Means those chain of events he could not register. Now after stabilization, like when you take him to the clinic and after stabilization, when you talk to him, he will be like oriented to the time, place, and person. So there is no loss of immediate memory. Now right now he's fine. And you ask like long back things like long memory is also preserved. But when you ask like how the accident happened, he cannot recall because that memory was never consolidated. Could you understand? So these things can occur. Very good, beta. Yes, you guys are correct. Very good. Acha, one more thing that I would like to say that I have got certain queries about extra edge file है ना कि आपने मैंने किसी वीडियो में कहा कि एक्स्ट्रा एज फाइल के लिए आप मेरे को पीडीएफ के लिए बोल देना कुछ बच्चों ने मुझे मैसेज भी करा है तो मैंने उसको ईज आउट करने के लिए ना एक वे निकाला है वो वे ये है आई एम शेयरिंग विद यू गाइज लाइक माई ओके जस्ट अ मोमेंट यू गाइज आर young generation so you guys are there on the social media. This is my Instagram. If you guys are using Instagram, please be connected with me also. You'll be getting the updates. This is my YouTube channel, and along with that, on the Telegram group, on the Telegram app, sorry, on the Telegram app, you search Dr. Sandeep Dams Anatomy. You search, this group is public group. What's the name of the group? Dr. Sandeep Dams Anatomy. And in this group, you just join the group, and after that, you can search in the file section. There will be section like media, file, some other things will be there. So you can just go into the file section. Lots of PDF will be there. But specifically for the MDS, I have added the extra edge PDF over there. Along with that, certain other PDFs are also there. For example, connective tissue file is there, joints file is there. If you are interested, you want to download those, everything is available for you. Just go there and download whatever you want. Okay, बट यस दिस इज एटलीस्ट एक्स्ट्रा एज फाइल तो आप डाउनलोड कर ही लेना, वहां से कर सकते हो। अभी क्लियर है बेटा आप लोगों को कहाँ से क्या करना है आपका? फिर सेकंड पॉइंट, देर आर सर्टेन क्वेश्चंस वेयर we have taken the doubts but then still some doubts are pending. No problem. In our group, if something is still pending or I could not answer, please tag me once more over there, and I'll try to answer as soon as possible over there as well. ठीक है? तो कुछ अगर पेंडिंग है तो उसको भी हम सॉर्ट आउट कर लेंगे ताकि एग्जाम से पहले आप प्रिपेयर्ड होकर के जाएं। अब एक क्वेश्चन लेते हैं, ये बताओ, लेशन ऑफ व्हाट विल लीड टू फ्रे सिंड्रोम? किसके कारण फ्रे सिंड्रोम होगा? ए बी सी डी, बताओ बेटा। व्हाट इज फ्रे सिंड्रोम? दैट आल्सो विल अंडरस्टैंड, बट कैन यू आइडेंटिफाई? सो व्हाट इज ए बी सी डी ओवर हियर? Answer to this question is A. Why? Because this A is auriculotemporal nerve, B is nerve to mylohyoid, C is deep temporal nerve going to supply the temporalis muscle, and the D is buccal nerve which is going to pierce the buccinator but does not supply it. Question is, what is Frey syndrome? Let me tell you. We have the auriculotemporal nerve which is going to supply the parotid gland for the purpose of salivation. For the purpose of salivation, correct? But then we also have great auricular nerve which is going to supply the sweat glands on the skin. Skin above the parotid will be having the sweat glands. So what is the role? Is sweating. And sometimes what might happen, so that in case of there is injury, and after injury the auriculotemporal nerve goes and joins with the great auricular nerve. That means if the input comes for the salivation, end result will be sweating. So patient, if thinks of the food, smells food, sees food, tastes food, talks of food, in all these conditions normal person will have the saliva, like कहते हैं ना मुंह में पानी आ गया, salivation हो गया। लेकिन इस पेशेंट का क्या होगा? उसको स्वेटिंग होने लगेगा, पसीना आएगा। क्यों? उसकी जो पाथवे है वो स्लाइवरी ग्लैंड तक जा ही नहीं रही है, उसकी पाथवे कहाँ जा रही है? स्वेट ग्लैंड तक। तो बेसिकली what will happen is called as gustatory sweating, and all of you are correct beta, very good. Good to see that most of you are marking the correct answer only, and I'm very happy, and it gives me immense pleasure and satisfaction that my students are already prepared. So we are looking forward that you guys are going to rock this time and you guys are going to crack this exam. Anna, and how many of you can promise that yes sir, definitely I'll be cracking the exam, and then we'll be meeting me, okay, for the celebration, right? Who can promise that? Who wants to meet me for the celebration after you have succeeded? Anyone? Because right now we are meeting across the screen, but I would definitely love to meet you guys face to face. Okay, once you have succeeded we'll celebrate. How is the feeling like? It feels good na, when we talk of your success, and believe me that time is very soon it is going to come. Okay, अब बहुत गैप नहीं है आपके और आपके एग्जाम के बीच में, बहुत जल्दी ही आप उसको टच करने वाले हो, आपकी अचीवमेंट को, राइट? कौन कोई है जो इसमें कहना चाहता है कि हाँ सर पक्का मिलेंगे? हाँ, ओके। तो मैं एक like let me add one more point over here. Sometimes you might not feel that much confident, but let me tell you, we are confident on our for our students first of all, and take some confidence from us. In our confidence, merge your whatever little bit confidence that you are having. Somehow believe in yourself, somehow believe in God, and work hard, give your 100%, and trust me, miracle will happen. Okay, and you will be succeeding, and I am pretty sure, as they say, fake it till you make it. तो शुरू में झूठा ही सही, लेकिन एक आप विश्वास लो और उसके भरोसे पे आगे बढ़ो, अपना बेस्ट देना है, बाकी रब रखा। कर सकते हैं, इस बार करेंगे। बिल्कुल, बहुत अच्छे, सब लोग करेंगे, वेरी गुड बेटा। अब ये क्वेश्चन आया है, लेशन ऑफ व्हाट विल लीड टू पैराडॉक्सिकल रेस्पिरेशन। लेट मी फर्स्ट एक्सप्लेन व्हाट इज पैराडॉक्सिकल रेस्पिरेशन. So we have two domes of the diaphragm which are supplied by two phrenic nerve, left and right. If one of the nerve is gone, like this becomes flabby, but the other one is working. If this becomes flabby, this is going down in the inspiration. It can't even remain in the neutral position. Why? Because during the inspiration, the intrathoracic pressure is negative. It will suck in. So this is going down, this is going up. Paradoxical movement will take place. Why? Because of phrenic nerve injury. So indirectly, the questions ask us to identify phrenic nerve. Which one is phrenic, beta? We can say answer is A. Why? Because if you look at this muscle, this is scalenus anterior muscle. This muscle behind is scalenus medius muscle. And in between we can see this artery is going, this artery, okay, this is subclavian artery, and we can see the various branches of the subclavian artery, but right now we are focusing on the nerve. What is this A nerve? This A is phrenic. Where is that? Anterior to scalenus anterior. What is this B? B is vagus. Where is that? Again anterior to the scalenus anterior muscle. If both are anterior, how are we going to identify? So please remember, both of them are anterior, that's true, but phrenic will be just anterior to the muscle. Vagus will be further anterior. And what about the C? C is some sympathetic fibers coming down. These are the sympathetic fibers. And what about D? D is the recurrent laryngeal nerve, because it is going to supply, it is going to run in the tracheoesophageal groove. It is going upward. We can see it is going upward. It is a branch of vagus going upward into the tracheoesophageal groove. I hope that makes sense. Yes. So we are done. Let's move on to this. Let's see this question. A patient, 23-year-old woman, is brought to the emergency department. Patient is unconscious, but the fracture has been defined at the junction of this particular part: parietal, frontal, temporal, and sphenoid. Now, before proceeding, can you tell me the landmark name? What is the name of that particular area where these four bones are like having the joint? The junction of these four bones is called as what? The name of that particular point or that particular area, we can say, that is called as pterion. Pterion. And deep to the pterion, which artery is present? The artery which is present deep to the pterion is middle meningeal artery. But if I ask you which division of middle meningeal artery is present, then answer will be anterior division of middle meningeal artery. So which artery is present is the middle meningeal artery, which division is present is the anterior division of the middle meningeal artery. And what's the importance of this? This is the most common vessel for the extradural hemorrhage. That is the most common vessel involved in the extradural hemorrhage. And this artery, middle meningeal artery, is a branch of which artery? Maxillary. So answer will be B over here. So that is straightforward question, but step by step we have reached the answer also. That's okay. But what questions so far have been asked about the pterion? So if at all they ask which artery, we are going to mark this. If at all they ask which bony landmark is deep to the pterion, then answer will be lesser wing of sphenoid. If they ask which bony landmark is present deep to the pterion, answer will be lesser wing of sphenoid. And if they ask that which part of the brain matter is present, then we can say stem of lateral sulcus. Okay, so these are different set of questions which have been asked and can be asked further. This is a very important area, beta. Next question. Molecular layer of the cerebellum consists of what? Now, Cerebellum is one such area where lot many questions have been asked and will be asked. They can give you histological picture. They can ask about the peduncles. They can ask about the you can say the climbing fibers, the afferents, the efferent, what is the output cell, anything can be asked. So cerebellum is very 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 important area. What will be the answer anyway? आंसर क्या लगाते हैं यहाँ पे? मॉलिक्यूलर लेयर में बास्केट सेल एंड स्टीलेट सेल दो सेल होते हैं, तो बी विल बी द आंसर. बट लेट मी describe little bit about the cerebellum. It's very important for us. We have the deep nuclei, and the deep nuclei, if you see from lateral to medial, we have the mnemonic that is doctor eat good food. Do we really? Hardly, never, है ना? But that's only a mnemonic. That's okay. What is doctor is D for dentate nucleus. That's the lateralmost nucleus. E for we have the emboliform nucleus. G for we have globose nucleus, and F for we have fastigial nucleus, like that. Okay. Now these are the deep nuclei. But if you take a section over here, in the section you will be seeing the cortex is having the three layers. Those will be visible. Then the white matter will be visible, and further deep to that we can see the deep nuclei also. That all those things in sequence will be visible like this. You can see the three layers. What are the layers? This is molecular layer, and this is Purkinje layer, and this is glandular layer. But how can we identify? See, for your exam, usually they don't give the histologies like that, but if at all they give, then how to proceed? Let me give you the hint. You try to search for the cells which are jutting out. Jutting out means they are neither fitting here nor fitting here. That means in itself they behave like a layer. Those cells will be Purkinje. And on the other side, one side of it, there will be black dots. That is granules. सो परकिंजे हमने आइडेंटिफाई कर लिया, ग्रेन्यूल्स हमने आइडेंटिफाई कर लिया, तीसरी लेयर हम एज्यूम कर लेंगे मॉलिक्यूलर एमपीजी. आई होप दैट मेक्स सेंस. व्हाट आर द सेल्स इन द मॉलिक्यूलर लेयर? बास्केट सेल एंड स्टीलेट सेल. परकिंजे सेल्स लेयर में वी हैव द परकिंजे सेल्स ओनली. But when we talk about the fibers, try to understand better. Try to understand, it's very, very important that these fibers are called as climbing fibers. Why? They can climb up directly to the highest level, and they can directly communicate here with the Purkinje. And they are coming from olivary nucleus. Only from the olivary nucleus, the fibers are climbing fibers. Now, let me explain this way. Just for an example's sake, if we say there are 10 areas from where the afferents are coming, just for an example sake I am saying 10 areas से afferent आ रहे हैं. One area के fibers will be called as climbing. Remaining 9 areas fibers will be very heavy mass, and they can't really go up on their own. So their input, they will reach somehow the lowermost zone, but their input will be delivered further by some cells. Which cells? These cells, these small cells. These small cells are called as granule cells. So we can say basket cell and the stellate cell in which layer? Molecular layer. Purkinje cell in the Purkinje layer. G for granule cells, G for Golgi cells. Where are they present? Granular layer. So these are the three layers and these are the cell types. But granule cells तक कौन पहुंचेगा? किसको help कर रहा है? Mossy fibers को. These fibers are mossy fibers which are coming from rest all other sources coming together. They will be reaching this lowermost zone because they are heavy. They can't reach highest. They will be reaching lowest layer. There they will make anastomosis with the granule cells. Granule cells, they will carry the information forward and they will be delivering to the Purkinje cells. Now Purkinje has received input from the climbing side, from the mossy side. They will behave as output cell, where the output will be given to the deep nuclei. And in the meanwhile, deep nuclei has received the input from climbing side as well as from the mossy side. It behaves as final output. So what I can say here, that if I ask you this question, output from cerebellar cortex, then answer will be Purkinje cells. But output from the cerebellum as a whole, then answer will be Deep nuclei. So far, so good. Is everything fine, beta? Can you please give me quick feedback? Is everything fine? Have you understood up to this much part? Yes. Now this question. Next question based on general embryology. This area, general embryology involving especially the pharyngeal arches, pharyngeal pouches, neural crest cells are very, very important for you guys. Okay. So the patient, some history is given, and eventually they want to know which of the following will be coming from second pharyngeal arch. Answer is straightforward, C. Because this anterior digastric comes from the first arch. This is a laryngeal muscle, comes from the sixth arch. Stylopharyngeus is the only muscle coming from third arch. So we need to remember, beta. Okay, we need to remember the arches. Okay, and I have made a small video how to remember the pharyngeal arches and the pharyngeal pouches and neural crystals. Okay, you can watch that small video on my YouTube channel. Okay, I have shared with you guys already, and in that you can just go there, and small video is there, hardly will take 10 minutes of yours, and you will, using the tricks, you will be able to find out. Fine, आगे बढ़े. अब ये question है. Let us look at this question. Tell me, what do you think will be the answer? A patient has difficulties speaking. Why? Elevation of the hyoid and the floor of the mouth is a problem. Now, sometimes I have seen students getting confused here. Like when they look at this language, they start thinking that how to, like, who is elevating the hyoid, who is elevating the floor of the mouth, and all those things. It can involve multiple factors. But what is the reason in this particular patient is already given. So you don't have to think. You don't have to add the information from your own side. क्या है क्वेश्चन में ऑलरेडी दिया हुआ है कैसे. These problems are because of they are secondary to paralysis of the posterior belly of digastric. So basically, what is the problem? This muscle is paralyzed, posterior belly of digastric, and just now we have learned posterior belly of digastric comes from second arch, anterior belly comes from first arch. If at all posterior belly of the digastric is not working, that means the nerve of second arch is gone. And what is the name of the nerve of second arch, beta? Very good, beta. All of you are correct. Answer will be D, facial nerve. Very good, beta. शाबाश. ऐसे ही करके आना है, रियल एग्जाम में भी ऐसे ही करके आना है. क्वेश्चन बहुत टफ नहीं होंगे. दे विल बी गिविंग सर्टेन ट्विस्ट ऑन, बट when they ask, they will be asking the concept based only, and once you are thorough with the concepts, if I ask you in the, like, all the elements, all the component of the tooth, okay, you are the master of the dentistry, teeth is your area of specialization, so let me ask you, all the components or elements, whatever you can say, of the tooth derived from neural crest cell, except one part. Which part? What's your answer? So whatever they can ask, you can ask dentine, they can ask pulp, whatever. So more or less, when you talk about the tooth, they will be coming from the secondary mesenchyme, and that develops from the neural crest cells. So eventually, in nutshell, we can say that tooth elements all are derivative of neural crest cells except enamel, which develops from ectoderm. Okay, enamel will be coming from ectoderm. Do you appreciate this part? Yes. Now this question, beta. There is a Brown-Sequard syndrome. What will happen? Any idea? So we have to find out which one is the false. Hemisection of the spinal cord will be true. Ipsilateral paralysis below the level of lesion, that is true. Now the sensation will be lost. Which sensation will be lost on the ipsilateral side? Vibration sense or the crude sense? Crude will be lost on the opposite side. So C will be the answer over here. Just let me explain. C will be the answer. That will be lost on the... How? Now let me explain, everyone. So remember, when the crude sensation enters the spinal cord, it is going to cross. So what is our mnemonic? CC. Crude, cross. at the level of spinal cord. What is crude? Pain, touch, temperature. So crude cross. And what we can say, fine, when they enter, it moves upward. How we can say? Because if I show you this diagram, you can see the fine is coming over here. Instead of crossing, it is simply moving upward so that it can cross at the level of the medulla. So what we can say, fine moves upward, so it crosses at the level of the medulla, but crude will cross at the level of spinal cord. So how to summarize? We can summarize this together by remembering this. FUCC. Okay, so fine moves upward, crude cross, and I hope you will remember now. Okay, तो ये हो गया किसके बारे में? असेंडिंग ट्रैक्ट्स के बारे में. लेकिन अगर हम डिसेंडिंग ट्रैक्ट की बात करें, देन वी हैव LMN एंड UMN. व्हाट इज LMN? लोअर मोटर न्यूरॉन. वो तो फुल फॉर्म हो गया, बट मीनिंग क्या होता है? एनी नर्व इज कॉल्ड एज LMN. व्हाट इज UMN? डिसेंडिंग ट्रैक्ट. So to keep it easy, let us write it down. And now let us discuss this. What is this? Spinal cord. Everyone please pay attention. And what is this? Midline. If you cut this much part, now let us discuss one by one. First, pain and temperature. Pain and temperature, what type of sensation? Crude. And our mnemonic is CC. Crude will cross. So when it approaches the spinal cord, it will simply cross and it can go up. No problem. But from the opposite side, it will cross. It wants to move up. Can this go up now? No. So which side pain and temperature is lost? Same side or opposite side? Obviously, opposite side, contralateral. So once we have come to the conclusion, we will write the information in the box. So what we say? Contralateral loss of pain and temperature. Everyone, you are understanding this? Now fine sensation, when they enter, we all know they will move up. This side they can go up, but where is the loss now? You examine and tell me. Fine will be lost on the ipsilateral side. Now, if this is the spinal cord that we are talking about, the nerves coming out will be spinal nerves. Name is spinal nerve, but the technical name is LMN. Do you understand? Because LMN is a nerve. And the tract coming from above is the corticospinal tract, but technical name will be UMN because the descending tracts are UMN. And when we are cutting, see here, when we are cutting over here, this tract got cut. That's why up to this much part it will be controlling this area. But this is cut part. Cut portion can't control here. So can't control means below the lesion there will be palsy. What type of palsy? UMN type. What is UMN type? Spastic. So there will be ipsilateral spastic palsy below the lesion. Now, last point. When you are cutting the spinal cord, you are coming from outside. Coming from outside means at least this nerve will be cut. Please pay attention. This nerve will be cut. Yes or no? So when you are cutting this nerve, at least this area will be additionally having the loss of element. So there will be flaccid palsy at the lesion. So now one by one we have seen the what is the injury, which side is the injury, and accordingly we have got the features. So finally we have these set of features observed in Brown-Sequard syndrome, and I hope it is clear to everyone. Next question. We have already discussed the facial nerve and I believe you will be able to tell the answer. Patient का क्या दिक्कत आ रही है? Patient is having the hyperacusis means stapedial reflex तो गया. Loss of lacrimation, greater petrosal nerve भी गई. Loss of taste sensation from the anterior two-third quarter tympani भी गई. अब है कहाँ पे दिक्कत आई होगी? अब if the patient is presenting only with the facial palsy, stylomastoid foramen can be the answer. Loss of taste, higher up, coda tympani. Hyperacusis, higher up, stapedial reflex. But loss of lacrimation, still higher up. That means proximal to geniculate ganglion. The geniculate ganglion is present at the level of genu. Genu is called as bend, from where the greater petrosal nerve will be given off. Clear, no? What structure can be felt at the lower part of medial border of sternocleidomastoid? Now there is no concept here, it's a factual question. And in your real exam also there will be certain questions which will be fact based. Fact based मतलब अगर आपको मेमोरी में वो फैक्ट पता है तभी आप आंसर कर पाओगे, सोच के कैलकुलेट करके नहीं पहुंच सकते. Concept based is where you can think, but fact based you have to memorize only. So here the answer is carotid artery. And let me tell you, in the extra edge PDF file, I have added this information. that where we are going to palpate for which artery. The points are also given, the image is given, pointers are given, okay, regarding the artery. Branches of the arteries also have covered, muscles of mastication, important stuff for you guys. I have added in that extra edge PDF. Just go through those pages once, I hope, and mostly it will be clear. If you are finding it very difficult some area, you leave it, okay, otherwise mostly it will be easier for you guys. Now this question, glossopharyngeal nerve supplies which of the following gland? Yes, we have written this information, but you have to tell me. Glossopharyngeal nerve itself is responsible for parotid gland. Why? Because it will give one branch, Jacobson's branch. Okay, kaise? Let me show you. So we have like this is middle ear. This is medulla, where we have the ninth nerve nucleus. From here, the ninth nerve goes out of the jugular foramen. Itself, the ninth nerve will go out, but it gives one branch in the floor of middle ear. That is Jacobson's branch. This Jacobson's branch will reach the middle ear, and where it is going to make one plexus. Which plexus? Tympanic plexus. From the tympanic plexus, this nerve will begin, that is called as lesser petrosal nerve, which will be passing through the foramen ovale. Along with this nerve, which is called as mandibular nerve, which holds the ganglion, which ganglion? Otic ganglion. So what really happens, it is going to give one branch. The name of the branch is auriculotemporal nerve, which is going to supply parotid gland. So what happens, the lesser petrosal nerve comes, it will relay over here, and after relay, these fibers will go like this, like this, like this, up to parotid gland. So that's the pathway. We can say Jacobson's branch is there. We can say tympanic plexus, lesser petrosal nerve, otic ganglion, auriculotemporal nerve, and finally parotid gland. So answer will be parotid gland. Clear hai? Everyone, you know about this pathway? Now, quickly, if I revise, can you answer quickly? Okay, and let me tell you how you can remember. See, we have highest gland over in our face. Look at this way. Highest is the lacrimal gland. So highest के लिए तो greater चाहिए ना आपको, जो सबसे high position पे उसके लिए great something चाहिए. So highest gland is the lacrimal gland. Which nerve will come? Greater petrosal nerve. उससे नीचे पैरोटिड. अब ग्रेटर यूज हो गया, लेसर से काम चल सकता है. लेसर पेट्रोसल फॉर पैरोटिड. फर्दर डाउन सबमैंडिबुलर एंड सबलिंगुअल. किस कौन से प्लेस पे? थर्ड प्लेस पे. तो थर्ड अल्फाबेट सी, कॉर्डा टिम्पैनी. डू यू अंडरस्टैंड? सो व्हाट इज द ग्लैंड हेयर? लैक्राइमल. लैक्राइमल हाईएस्ट ग्लैंड है. कौन सी नर्व आएगी? ग्रेटर पेट्रोसल. पैरोटिड नेक्स्ट. सो ग्रेटर यूज हो गया, लेसर पेट्रोसल. थर्ड नंबर ऑफ ग्लैंड, थर्ड अल्फाबेट सी, कॉर्डा टिम्पैनी. विल यू रिमेंबर दिस? Yes, Jacobson's is the one which is carrying the parasympathetic fibers. इसका काम है पैरासिम्पैथेटिक फाइबर्स को आगे कैरी फॉरवर्ड करना. इसके दो नेम होते हैं, टिम्पैनिक ब्रांच और जैकबसन्स ब्रांच. ओके, एंड ऑल्सो वी शुड अंडरस्टैंड, यहाँ पे हमने ड्रॉ किया है ना, ये जो नाइन्थ नर्व है, नाइन्थ नर्व विल गिव वेरियस ब्रांचेस. इट इज गोइंग टू सप्लाई स्टाइलोफेरेंजियस मसल. It is going to supply tonsil and oropharynx. It is also going to supply circumvallate papillae. It is going to supply posterior one third of tongue and also carotid body and sinus. Now, one point, it supplies tonsil and it supplies ear also. That is the reason that sometimes the patient can have the tonsillitis, but the pain is referred to ear. It is called as referred otalgia. ठीक है? तो पेशेंट ईयर एक लेके आया है, लेकिन पेशेंट को दिक्कत क्या है? पेशेंट को दिक्कत है टॉन्सिलाइटिस की। तो पेन रेफर्ड हो रहा है। ठीक है? I hope all the points are clear, beta. Yes. Now this question. Can you tell me what nerve is being blocked over here? This is the nerve which is about to enter in the mandible at this point, which will be traveling within the mandible from below like this. Okay, that is inferior alveolar nerve. A is the answer. ठीक है, inferior alveolar nerve A. So far so good. So that was all, dear friends. Okay, and this is me, Dr. Sandeep Madaan, and I am really hoping कि आप लोग बहुत अच्छा करोगे इस बार एग्ज़ाम में, और अपने आप के ऊपर भरोसा करके जाना है आपने, ठीक है, और अपना बेस्ट दे के आना है। और एक इम्पॉर्टेंट पॉइंट, व्हेन while attempting the question, this is sincere advice, at least read the question and option once properly, because sometimes the language plays a vital role in deciding the answer. Okay, तो what you are thinking कि कई बार हम ना आधा क्वेश्चन पढ़ते हैं, बाकी हम एज्यूम कर लेते हैं। एज्यूम नहीं करना, चॉइसेस भी एक बार के लिए वंस एटलीस्ट पूरी पढ़नी है ढंग से। तो लैंग्वेज ऑफ द क्वेश्चन एंड ऑप्शन एटलीस्ट रीड देम वंस प्रॉपरली विदाउट हैविंग एनी बायस। अपनी तरफ से एज्यूम नहीं करना कि ये दिया होगा या ये टॉपिक है तो ऐसे ही आंसर बनेगा, नहीं, ऐसा कुछ मैंडेटरी नहीं होता। ऑलराइट, ठीक है डॉक्टर साहब, आप लोग अपनी मंजिल को पाने के लिए आगे बढ़ रहे हैं। आपकी मंजिल के लिए एक शेर सुनाऊं आपको? यू गाइस आर गोइंग टू अचीव योर, है ना, डेस्टिनेशन। एक शेर सुनाऊं आपको? राइट, तो अर्ज किया है, रख हौसला कि वो मंजर भी आएगा, प्यासे के पास चल के समंदर भी आएगा। ओके, रख हौसला कि वो मंजर भी आएगा, प्यासे के पास चल के समंदर भी आएगा, थक कर ना बैठ, थक कर ना बैठ ऐ मंजिल के मुसाफिर, मंजिल भी मिलेगी और मिलने का मज़ा भी आएगा। ओके, ऑल द वेरी बेस्ट, गॉड ब्लेस यू ऑल, फ्रॉम द कोर ऑफ माई हार्ट आई प्रे टू गॉड फॉर यू गाइज ग्रैंड सक्सेस। तो जल्दी से एग्ज़ाम दीजिए, सक्सेसफुल हो जाइए, एंड विल डेफिनेटली